Great. Good morning. I'm Ashley Furlong, a healthcare reporter at Politico, and I'll be your host for this event. Today, we're going to be talking about stigma around HIV and how to tackle it. You'll be hearing about the data on the topic, how stigma presents itself, how it manifests in healthcare settings, and how to reduce it. Data from the European Centre for Disease Prevention and Control, which you'll be hearing about in just a bit, shows a picture of significant numbers of people not telling their family members and friends that they are HIV positive, fearing that they'll be treated differently by healthcare workers, or being afraid of seeking healthcare because of their HIV status. We'll hear about how stigma has the potential to permeate every aspect of the life of someone living with HIV. We want this event to be as interactive as possible, and you are encouraged to engage with audience members in the chat on the right-hand side of the screen and put questions to our panelists there. We'll have a decent Q&A section at the end where you'll be able to ask your questions to the panelists, so please put them in the chat as they're giving their presentations and as you have questions for them. Please also engage with us on social media using the hashtag zero-stigma. You'll see there's also quite a lot of content already up on social media with that hashtag. And please also note that this event is being recorded and will be published by the ECDC on their YouTube channel shortly after the event has ended. First up, we'll be hearing from ECDC Director Andrea Amon, and I'm really excited to invite her. She's on stage there, as you can see her, and I'm going to give the floor to her. Thank you.
Thank you so much, Ashley, and good morning to all of you, dear colleagues. It is now 35 years ago that WHO established World AIDS Day, which was actually the first ever international day for global health. And still in 2023, we are marking World AIDS Day as, despite significant and tremendous scientific advancements, HIV continues to affect large numbers of people around the world, including in the EU-EEA. In 2022 alone, nearly 23,000 people were diagnosed with HIV in the EU-EEA. However, unless 35 years ago, today we have effective preventive and treatment measures. Today, HIV is no longer a death sentence, but a chronic, manageable condition. Today, with the right treatment and care, people with HIV can live long and healthy lives. Nevertheless, despite the multidisciplinary progress in the overall HIV/AIDS landscape, one area has not changed enough compared to 3.5 decades ago, and that is stigma and discrimination against people living with HIV, which still remain formidable barriers to progress. People living with HIV often do not only face the challenges posed by the virus itself, but also the burden of social prejudice. And this not only undermines the mental and emotional well-being of those affected, but also discourages people from seeking treatment, testing, treatment, and care support. However, the data on HIV stigma and discrimination are scarce. So in order to improve our understanding of stigma experienced by people living with HIV, in 2021, ECDC, in collaboration with the European AIDS Treatment Group and AIDS Action Europe, initiated an exploratory survey to measure HIV-related stigma across Europe and Central Asia. And the results, and you will hear more about these, they show that stigma can be experienced differently between groups of individuals and in different settings. It can be experienced even internally as self-stigma, as well as from friends, family, and sexual partners. It can be experienced in healthcare settings, unfortunately, as well as other parts of society. It is crucial to identify stigma are most prevalent in each of these domains, so that efforts can be made to eliminate both perceived and experienced stigma for people living with HIV in a targeted manner. For this, we strongly encourage countries to enhance their monitoring of HIV stigma and to use this information to address these issues in healthcare and other settings. Reducing the transmission of HIV and eliminating new infections are critical components in ending the HIV/AIDS epidemic by 2030. And this goal cannot be attained without addressing HIV-associated stigma and discrimination. Of all the important actions that will be discussed today, I see that ECDC could add most value in the area on monitoring. ECDC has taken already a leadership role in this area to ensure that data related to stigma and discrimination are collected in a reliable and timely way to monitor internet-related targets in an effective way and to develop new standards and measures. And this includes, for instance, collecting health-related quality of life indicators, such as self-rated health, self-rated health, unmet mental health needs, and non-discriminatory access to and treatment within healthcare. So in conclusion, for World AIDS Day 2023, let us recommit ourselves to the fight against HIV stigma and discrimination and continue the work together on this pressing issue of supporting the advancement towards an inclusive society for all people living with HIV. I wish you very good discussions today, that you hear enough to motivate you to continue along this goal. Thank you very much.
Thank you so much, Andrea. I just want to put one quick question to you about, so the ECDC is obviously harnessing some of this data and collecting it and putting it together. How can we use that to take action to reduce HIV stigma? How can the people on the call use the data that the ECDC is collecting on this and actually implement effective interventions?
I think you will hear also more about this in the course of this seminar. But when I saw this data for the first time earlier this year, I just thought it's impossible. I started my professional life as a HIV counselor, doing giving information to the population and do HIV testing. And I was just not believing that even now, 35 years later, there is such a prejudice around where we have so effective means to treat the condition. I mean, I think that alone, the figures alone will raise an awareness that we couldn't do with words alone.
Thank you so much. I really appreciate you taking the time to speak to us today. We're going to be heading to our first presentation. You'll be hearing from Teimur Nuri, an expert on HIV at the ECDC. He is primarily responsible for monitoring the HIV response in Europe and Central Asia, including monitoring the continuum of HIV care. I'm going to hand over the floor to you for you to present some of the data that we already just had a little taste of just now.
Thank you, Ashley. And I am trying to share my screen. The share button is not being allowed to be shared somehow. Are you there, Andre, to help support that? Hang on, there we go. No,
I just saw it. It popped up.
Okay. The share button. Okay, somebody else is sharing it, I think. So you see it now?
I see it.
Okay, perfect. So I'm not in control now. Anyway, so thank you for that introduction, Ashley. So let's move on to the next slide. So I'll be sharing some of this data that Andrea was talking about. And the first thing I want to share with you is that based on the data we have from the end of 2021, we estimated that 2.3 million people were living with HIV in this wider WHO European region. A third of those lived in the green countries here, what we categorize as the West, 2% in the center, and 62% in the eastern parts of the region. So the true burden is really in the eastern parts of the region. We estimate that around 760,000 people are living with HIV in the EU, EEA. Next slide, please. So UNAIDS have these targets, right, for when it comes to stigma, and the targets say that we need to see less than 10% of people living with HIV and other key populations experience stigma and discrimination. And next, please. And the reason for this is that this impacts all our other targets, right? So the higher stigma you have in a society, the bigger the challenges are going to be in reaching these targets in other areas. Next slide, please. So as Andrea said, we have had a problem with the data around this issue. For the 16 years that I've been working at the CDC, we've been trying to monitor the full HIV response in our region, and we have pretty good data when it comes to prevention, testing, and treatment. But when it comes to stigma, we've had a big gap. So around 2 years ago, we reached out to our partners, European AIDS Treatment Group and AIDS Action Europe, to see if we could do a so-called quick and dirty survey to see if we can have any comparable data across the region, because we didn't have that. And that's what I'm going to share some of the data with you today. And then simultaneously, we reached out to the European AIDS Clinical Society to try and measure HIV stigma in the healthcare setting. And I'll just say a few words around that, and then Esteban will talk much more about that going forward. Next slide, please. So as I said, we presented this data at our HIV network meeting and a high-level meeting during the Spanish presidency to the EU Council in September. Again, this is the report, and there's a link to the report. Next slide, please. So one of the first things we wanted to ask was, how satisfied are people living with HIV with their lives, right? And this is a standardized instrument called the Life Satisfaction Score. And as you see here, around half the respondents said they rated their life satisfaction score as pretty high, 16% is pretty low. So the average life satisfaction score was 6.2, and there have been similar studies in the general population in the OECD countries, and that the latest data we have there is 6.7 average score. So people living with HIV rate their scores a bit lower than the general population, but overall relatively high. Next slide, please. So one of the important issues around stigma is its effect on mental health. And this data that we're asking here is, you see the various forms of stigma at the bottom there. And we asked people if they had felt depressed in the past 2 weeks, how they would respond, and comparing that to those who were not feeling depressed. So the blue bars here indicate that those who said that they were feeling depressed 2 weeks prior to responding to the survey. And regardless of the various forms of stigma at the bottom, you see that those who had felt depressed in the past 2 weeks experienced these stigma forms twice as likely almost in all categories compared to those not feeling depressed. So this really speaks to the importance of providing mental health services to people living with HIV. And we can't really say here if you're feeling depressed because you are experiencing stigma or vice versa, but there is a clear association. Next slide, please. So self-stigma is a really important area. So we asked respondents these 3 questions, and you see here 6 out of 10 of the respondents said it was difficult to tell people about their HIV infection. A third of respondents said they had self-poor esteem because of their HIV status, or that they were ashamed of their HIV status. So very high percentages. And all the data I'm showing you now are baseline data, so we can't really compare it to something, but we'll monitor this going forward and see if there are improvements over time. Next slide, please. So this is very important data here showing the proportion of respondents who had ever told of any family member, friend, or current sexual partner about their HIV status. On the far left, you see that 1/3 of respondents had not told a single family member that they were living with HIV, 1/3. That drops to 1 in 5 when it comes to friends, and 1 in 5 that have not told a current sexual partner that they were living with HIV. Again, benchmark data. Next slide. So this shows you the experience of stigma from family, friends, and sexual partners. On the left-hand side, you see the various forms of stigma. And in the red boxes there, or those that are marked with percentages at the end, that shows you those who had ever experienced this form of stigma. So 1 in 4, 24% had ever been rejected by friends. and the red bars indicate in the last 12 months. So 6% had experienced that in the last 12 months. And then you see how that drops according to which forms of experienced stigma. So next slide, and this shows you the experiences of stigma in healthcare settings, and here you see the proportions are very much higher. So 56% had ever been worried about being treated differently by healthcare staff, 26% in the last year. And that actually has a major impact on actually people avoiding healthcare, which is the next box there, services being avoided healthcare altogether because they were expected to be treated differently. So the worry is actually having an impact on the actual health-seeking behavior. So next slide, please. So this shows you experiences of stigma within the justice system. We know that people living with HIV have been worried about, that they're concerned about they may be criminalized because of their HIV status. And here we have actually data on that showing you that 28% have ever been concerned about being criminalized because of HIV status, and 12% in the last year. So that's, again, very high proportions. Next slide, please. So this data we do not include in the report. The biggest group in our responses are men who have sex with men, and we don't have huge sample sizes for these other key populations. So not looking at the percentages per se, I do think it's important data to show here that I think the data seems to suggest that depending on which key population you belong to, you're going to experience stigma quite a bit differently. So this is something that we want to look into a bit more in our next time we report this survey. Next slide, please. So this is some of the data from the community survey that we've collected and published, and now we're working with EACS, as I said, to measure stigma in the healthcare setting. This survey just closed yesterday, so it's been open for around 2 months, and it closed yesterday. Next slide, please. And basically, I just want to show you that we've had really high uptake of this survey. Here you see the countries listed, and you see here the sample size per 100,000 population, and overall we got more than 13,000. So this is older data. This is from 13th of November. We have data now from 2 days ago where we have over 18,000 responses. So really, really great response. And this is now what we're going to be looking into and analyzing this data in the next couple of weeks and months. Next slide, please. So to conclude, there is a strong need to consider how health-related quality of life data collection can be standardized. That's why we've done this for the first time. Actually, you asked the question, how can this data be used? And first of all, we need the data. We've lacked the data altogether. So this is a huge step forward to have this data at all. So here, what I presented is that 1 in 5 people living with HIV have not told a single family member that are living with HIV. 1 in 3 have not told, a friend, and 1 in 3 have not told a single family member. There's high levels of experienced stigma from family and friends, and even higher levels of experienced stigma in healthcare settings. And overall, the conclusion is really that people living with HIV are worried about being treated differently because of their HIV status. And this affects disclosure to family and friends of their HIV status, but also affects health-seeking behavior, which ultimately impacts negatively on the quality of life. So overarching conclusion is that HIV-related stigma is highly prevalent, and more efforts are needed to address stigma in order to improve the quality of life of people living with HIV. Next slide, please. So these are the people that we need to acknowledge: colleagues at ECDC, National AIDS Trust, who are some other consultants, colleagues from EATG and AIDS Action Europe, and of course, all those people that took time to fill out the survey. And yep, I'll stop there and over to you, Ashley.
Thanks so much. I think it's really shocking data, as Andrea said earlier, and it's very shocking in that we've had so many years of activism, so many years of medical developments and educating communities, and we're still at this stage. But I think it's a really important baseline that we understand where we can improve from, and hopefully it's only an improvement from there. And we're going to be hearing more about interventions and things that actually work to reduce stigma. So thank you so much, Timo. We're going to be hearing a presentation now from Sini Passanen, who is Executive Director of the NGO Positiviset. My Finnish is non-existent. HIV Finland, and the Vice Chair of the Finnish National HIV and Hepatitis Expert Group. She's also Chair of the HIV network. And she's also been chair and a steering group member of AIDS Action Europe and part of the HIV, hepatitis and TB related organizations. And she'll be explaining how stigma is perceived in various settings, including healthcare. As we've heard, that's a critical area, but also in the workplace, the community and private life. So very in every area, really. Over to you, Cindy. Thank you.
Thank you, Ashley. Thank you for the introduction, and thank you to ECDC for organizing this important webinar. So my topic is how is stigma perceived in different contexts, healthcare, workplace, community, and private life. Next slide, please. Yeah, there have been, during the years, quite many definitions have been made about what stigma is, what are the social dimensions of stigma, how stigma manifests itself, etc. So one way to distinguish the different kind of stigma is to talk about perceived stigma, self-stigma, and enacted stigma. Self-stigma, of course, referring to the feelings of shame and guilt, for example. Enacted stigma being the actual denial of services and discrimination, for example, in healthcare. But perceived stigma refers to discrimination and devaluation by others, negative attitudes, beliefs, and behaviors that individuals living with HIV may encounter from others due to their HIV status, but also to the expectation and fear what you might encounter when going to, for example, the healthcare services based on your HIV status. Next slide. So stigma in healthcare settings. Do you have any other life management problems perhaps than HIV? This question is sometimes heard, at least in Finland. It's kind of is sometimes shocking and comes by surprise. So people really have experienced stigma and discrimination in healthcare settings, as we heard from Timo's presentation already. Here is a short summary of few lines from the policy brief that's been written within the AIDS Action Europe's HIV legal forum, the European HIV legal forum. These are from the reports written about stigma and discrimination in healthcare settings, if you are as a client or patient, or if you are working at healthcare settings. So the healthcare sector represents an area where people living with HIV are very often very vulnerable, as you usually have to disclose your HIV status to the healthcare providers. And across Europe, there were numerous cases also identified where, in practice, people living with HIV have been refused treatment, they are harassed by staff, and their rights being breached. Also working in healthcare, people face considerable stigma and a range of prejudices, often based on misconceptions of the risk of HIV transmission. So there is stigma in healthcare settings, and people are facing stigma. Next slide. But also here is an example from the stigma index done in Finland. A comment. I can't really say that I don't face stigma in healthcare because I never even tell them I'm living with HIV, and that's because of stigma too. So you can't really say that you are facing stigma if you never disclose your HIV status. Next slide. But as we've heard, there is most stigma, I think, today in non-HIV related healthcare. The same stigma index that's been done quite recently in Finland and the other corner of Europe, Portugal. In Finland, 60% of the respondents said that they tell about HIV when they are seeking other healthcare than HIV healthcare, and 40% don't ever disclose their HIV status. In Finland, 57% are sure that their medical records are kept confidential and not shared without their written informed consent. 26% are not so sure or don't know, and 17% is sure that and say that it's clear to me that my medical records are not kept confidential. In Portugal also, the stigma and discrimination are higher in healthcare settings. These experiences were reported by 22% of respondents during the past 12 months. Also, 11% reported that they avoided physical contact and extreme precautions, and 6% faced the same kind of precautions or avoiding physical contact and in health services related to HIV. Next slide, please. So stigma is really faced across the whole healthcare sector. It's not just public healthcare or doctors or nurses, it's private healthcare, public healthcare, laboratories, doctors, nurses, dentists, midwives. Here are some examples from the interviews we did in Finland. The first one, after giving birth, I was simply informed that I shall not breastfeed my baby so that I won't transmit the virus. The way I was addressed was unpleasant, and I felt like as a new HIV positive mother, I wasn't trusted. This person also said that it would have been, if it was a question that what do you think about breastfeeding your baby, or if she had been given just a few more seconds to think about it, it would have changed the whole thing. But now she felt really stupid and stigmatized and not trusted. In 2008, my doctor pitifully expressed his condolences after having informed me of the HIV infection. And of course, we know that the longer people have been living with HIV, of course, you've been experienced in the earlier years more stigmatizing and discriminatory practices. But this was in 2022. A nurse told me after booking a doctor's appointment at the health center that I should make sure that I won't infect the doctor in the consulting room. Next slide, please. Stigma at the workplace. I think this is one part that people are disclosing their HIV status least. Here's a comment in the workplace. I haven't dared to tell anyone about living with HIV, fearing that the information might leak out. If it has happened, people have disappeared from my life. Also, you don't know what is going to happen if someone knows. Most likely nothing, but it's not worth taking the risk. I think most what we hear that people feel it's better not even to disclose their HIV status at the occupational healthcare to make sure that no one knows. But also what came out in the stigma index that there are more experiences of gossiping than elsewhere. 36% of the respondents reported that they know their HIV status had been disclosed behind their back to other colleagues at work. I think that the kind of discrimination is quite rare these days, but there are on the right-hand side, there are some small percents, but the job description has changed or promotion was refused. People have been reporting they didn't get the job or lost their job or source of income. I think these have happened more in the previous years, not very recently. But in Portugal, 8% reported that they decided not to apply a job because of their positive HIV status. Next slide, please. Stigma in communities, and there I think we are also facing the intersecting stigmas, and because stigma is created in the first place in social situations and relationships, it's culturally context bound, and stigma, it really exists everywhere, as we heard also in the Teemu's presentation. People living with HIV have meaningful communities where they belong. For example, migrant communities and religious communities, but also, for example, fetish groups. And these communities are often small and very tight-knit groups. And the smaller and more tight-knit the group is, the more I think there is fear of social exclusion, and it's definitely higher than in society in general. People might have a past of many years of drug use. They use drugs. They are sex workers, belong to gender and other sexual minorities, are migrants and belong to mobile populations, are people in the move. Of course, some communities might be and are safe environments, but also belonging to certain communities might create other stigmas and other vulnerabilities. And sometimes this also creates that it might be difficult to know why you are stigmatized when seeking certain services. But we know that in smaller communities, people feel it's really difficult to disclose, and it's very rare that you disclose your HIV status. Next slide. So how is stigma perceived in private life? Again, I think we heard quite clearly from the Tamer's presentation that disclosing HIV status is difficult. People are not disclosing their HIV status to friends, family partners, sexual partners. This is, we hear sometimes that first you are waiting for the right moment to disclose to your friends, close friends, but then time just passes and suddenly it's been 20 years or over 20 years that you haven't disclosed your HIV status, and then it's difficult, and at the same time it's kind of ridiculous what people feel. People have heard others than family members gossiping or saying stigmatizing things during the years, and also people tell things about other people when they think you don't know them. But for example, Finland is quite a small country, and then suddenly you know the person you are talking about. When it's about arguments, conflicts, divorce, or separation situations, if you are not living openly as a person living with HIV, people feel that you are actually putting quite a few weapons in another person's hands when you tell them about your HIV status. People have experienced blackmailing, threatening, physical abuse. One comment was also that I have told my friends, but I haven't told my small children. Stigma affects in the sense that you tell someone, but not others. On the other hand, HIV stigma affects even as older, when the own children already know about their mother's HIV status, but they cannot talk it with others. In this way, HIV stigma creates a taboo of silence that goes from generation to generation, and it's sad. Also, I think it's kind of remarkable that in today, this year, 2023, we are still in different countries in Europe. We are attending funerals of persons where only one person in the funeral knew that the deceased person had HIV, and this is quite sad. Next slide, please. One thing, the criminalization that was mentioned, and here also that 28% of the respondents reported having been concerned at any point in their lives that they may be criminalized due to their HIV status. I think this criminalization of HIV transmission and exposure, it's been one of the most impressive forms of stigma, and we can't really talk about stigma and discrimination without mentioning the criminalization. In Nordic countries, there's been a huge problem, I would say, during the years. Now it's luckily getting better, and it's not that big issue anymore. But it's been a lot, and it's been a topic that's been of interest to the media. We've seen the tabloids, the pictures of people living with HIV on the front pages, and very stigmatizing media. And the experiences that been there, they really have a long shadow. Next slide, please. To mention where the stigma and discrimination kind of comes from, in Finland, we really didn't know what the general, so-called general population think about HIV and people living with HIV. So we did a small online survey a year ago in December and January. We had 2 surveys, both had 5 questions, and we had in both 500 respondents. And the age group was very, very wide, from 16 to 75. The next slide, please. So a list of some examples and some percents. So 52% knew that when a person is on treatment, HIV doesn't affect your life expectancy. And 51% knew that a person living with HIV can have HIV negative children. 35% responded that they think that they have enough and updated information about HIV. 21% had ever been tested for HIV from their own initiation. We wanted to kind of exclude us in Finland. We've been testing pregnant women for since I think in the end of the 90s. 66% think that the most common way of transmission is drug use. The actual percent for 2022 in Finland was 7%. 73% said they think a person living with HIV should always disclose their HIV status, no matter what situation, but just always disclose. 9% of the respondents knew someone who is living with HIV. 14% answered that you can't get HIV from a person who is on HIV treatment, and 16% answered that they believe that the undetectable means untransmittable message, that this fact is actually true. 28% said they don't know. Next slide, please. So this kind of last comment from our stigma index interviews in Finland. When you cannot disclose your HIV status or have to hide it, this creates a generational stigma that works in the form of secrecy. So we were discussing that people living with HIV also kind of understand their own part of the structures of kind of perpetuating stigma. But of course, it's not the role or task for people living with HIV to break the stigma. The last slide. Yes, thank you.
Thanks so much, Sini. I think it really shows that stigma permeates everything from the most private moments to the most public. And it was very good context, I think, to put the rest of our discussion into. So thank you very much. I'm now going to welcome Esteban Martinez, the president of the European AIDS Clinical Society. He's also a senior consultant at the Infectious Diseases Unit at the hospital clinic in Barcelona. And he's also associate professor of medicine at the University of Barcelona. And he'll be talking to us about stigma in healthcare settings in particular. Thank you, and over to you.
Thanks, Ashley, for this kind presentation, and also thanks to ECDC for having allowed me to be here. So next slide, please. What we know about stigma in healthcare setting is quite a lot, and we have been reminded of a few of these aspects by previous speakers, and we will with the next ones surely, and with the discussions. But certainly I would like to say that the stigma starts, if we think about the cascade of care, the stigma is the bar before the bars. So it appears before the cascade of care, disturbing or preventing people from getting tested or having access to prevention, and certainly those with HIV having the link and the maintenance through the cascade of care. So stigma is before anything in the healthcare, and also throughout the whole healthcare. Next. We also know that there are several types of stigma that can be present in the healthcare settings. And just to give you some examples very briefly, there may be an anticipated stigma because of previous negative experiences. The persons may think that they will be confronting a disrespectful environment or persons. They may also have some kind of internalized stigma because they have been given ideas in a repeated way to feel ashamed of having HIV. Also, they may experience a stigma with certain attitudes. For instance, if the healthcare professionals, the doctor, takes excessive care, not supported by science, to deal with the person. And also, there may be also sources of stigma in the healthcare setting, such as policies leaving persons with HIV to be the last ones to be attended or to be operated in the surgical room because of fear of contamination or contagion. And also there are inner thoughts that the persons with HIV may be different from what it should be, let's say, normal people. Those things are consciously or unconsciously within the minds of any person. Next. And also, the stigma in the healthcare setting may be more subtle, may be difficult to find, even outside of the healthcare setting. Sometimes maybe expressions or behaviors that may be considered neutral or even funny, or that are sometimes overstatements, which is called microaggressions, may also undermine the respect and the dignity of any person. So you don't like you have HIV at all, or you're really looking great, so it seems that you are not ill, or something like that, may also although be something that may be minor, may be very important for the person who receives these comments. Next. So just to put an example, because there are literature all over the world, but this is a sample from the southern states in the USA. Primary healthcare workers and public healthcare workers were asked a series of questions, and you can see those ones with an arrow, that the percentage of people agreeing with the statement that people living with HIV could have avoided HIV if they had wanted to, or people with HIV surely may have many sexual partners, or people get infected of HIV because of their fault, or that they should be ashamed of being a person with HIV. So this is just examples not coming from the general population, but from healthcare workers who are supposed to know about HIV, at least in a more deep way than the general population. Next. And also language everywhere, but particularly at the clinic. Obviously, language is important. It's a way persons communicate with each other, and certainly from the beginning of the HIV epidemic, there have been language threats that may be laden with stigma and blame. For instance, failing treatment. It seems that the person is responsible of having a negative outcome, or serodiscordant, which is also a negative contention. So some institutions and some groups have addressed this point. For instance, I would like to say People First Charter, for instance, looking in different languages, because the cultural issue is also behind the language, how to manage some words or expressions that should be avoided into more respectful ones. Next. And also, very important, this is at the basis of any relationship, and particularly healthcare relationships. We, doctors and other healthcare professionals, are taught a lot about science, about technicalities, but we are not so well taught about compassion and respect. So this is at the basis of any human relationship. How to listen, how to be thinking what the other person is expressing by words or without words, how to feel how to make them feel that we are by their side. So this is so important, and it's something that comes with the person but needs to be learned too. Next. And we also know within the healthcare settings that not everybody behaves the same in terms of a stigma. For instance, the closer that the professional may be working with people with HIV, the lower the stigma. And this is not surprising. You can see on the left-hand side data from Spain, Maria Jose Fuster, in 2013, in which you can see that the social worker had the lowest stigma index, followed by psychologists and physicians. And on the other edge, administrative staff, auxiliary staff, or ancillary staff had the highest ones, maybe because their relationship is isolated with people with HIV. And on the right-hand side, you can see different settings. And not surprisingly, again, at the bottom, you can see that those professionals working at the HIV clinic of the infectious diseases ward had the lowest percentage of discrimination, and those healthcare professionals not having a continuous or a routine relationship with people with HIV may have the highest. Next. So why addressing stigma in the healthcare settings is important? Well, it is important, certainly it's obvious, but we have to remind of it, because the fears of stigma and discrimination and the lack of confidentiality in health facilities can discourage people from many important things related with HIV and other health contents. So they may be preventing of accepting to be tested for HIV or to have access to PrEP if they have a risk for HIV. They may be also prevented of linking to HIV care after receiving the diagnosis, or to adhering to PrEP or to HIV visits and treatment if they have HIV. But also, more importantly, they may be prevented of getting other kinds of healthcare that they may need. And this is certainly a kind of isolation or blockade from the healthcare provision. Next. So Taimur reminded you previously that the collaboration between partners is essential, and ECDC has pioneered the efforts in the European region with different partners, with the community, and you have heard from Taimur's presentation the results of the survey measuring stigma in the community. And we have been fortunate at EACS collaborating with ECDC in the project measuring stigma in the healthcare setting that I will present to you in the next slides. Next. So in the community, just a reminder that persons from the community were worried about being treated differently in a huge percentage, more than 50%. And although the percentages were within different years, it was most common in the recent past, in the recent year. And although this may be a recall bias, it may also represent that stigma is ramping, is increasing in as perceived by the persons with HIV. Next. So you have heard about this survey. Fortunately, we have been able to prepare, to launch, to maintain it, and to close it very recently, as Taimur mentioned. It is addressed to healthcare workers with 18 or more years in the WHO European region. It is anonymous and confidential, and it takes a very short time, less than 10 minutes to be done. Next. So it is the region, the WHO European region, which for those who may live in the western part of Europe may be difficult to imagine, but geographically it's very big due to the size of the Russian Federation, but also with big countries in terms of geography in Central Asia. So 53 countries are represented here. Next. The survey collects general information. You can see here, just as an example, age, gender, the country of residence, the country of birth, and also, because it is addressed to healthcare professionals, the time that have been spent in the clinic, the relationship, the professional relationship with people with HIV, and whether they have been ever trained in some important parts that have to do with stigma. Next. We have specific questions addressed to knowledge. For instance, just as an example, one question is, do you agree or disagree with the following statement? People living with HIV who are on effective treatment and have an undetectable viral load cannot transmit the virus sexually. This is one of the questions. Next. We have also questions about prejudices. Would you be worried about getting HIV if you touch the clothing of a patient living with HIV? This is another example. Next. And also attitudes. Do you typically use any of the following measures when dealing or treating persons with HIV? Avoiding physical contact or having gloves, etc., etc. So these are examples. Next. The survey has been a big effort. It was thought at the beginning of the year. It was materialized some way in May, and from May until September there was a preparation of the content and also the strategy, how to launch and how to maintain the technicalities, and also the survey lead and the interest for the survey across the countries that were going to participate. We have been running the survey from September until the beginning of December, and we hope that by the end of the year we will be able to have the first analysis and probably the results, the major results. Next. So with this, I would like to thank Taimur Nori and his colleagues at ECDC, Andrea Amon, Anastasia Ferris, and many others, Ana Mendez Lopez, who has been the coordinator of the survey and a real asset in making this success. My colleagues Joel Berritten and Jasmine Verbeek and the rest of the EAC Secretariat, my colleagues at the EAC Bureau and the Governing Board, the focal points at each participating country, which they have promoted the survey, and they have been also key leaders in their countries. And also my friend Julia Del Amo and her colleagues at the Ministry of Health Spain, because they have promoted explicitly the fight against stigma and discrimination within the European Union and beyond. Thank you for that.
Thank you so much. I think the biggest sort of call to action there is please go do that survey. I know that there's lots of healthcare workers on this call, so please help the ECDC out and contribute to this data collection effort. We're now going to move to Adam Shanley, the manager of the Empower program at HIV Ireland. He works closely with his peers in the LGBTQ+ community and across Ireland's sexual health sector to devise evidence-based, peer-driven and community-located interventions that help gay and bisexual men to have healthy sex lives. Adam will be providing us with examples of how to actually reduce stigma, and he's been involved in some really interesting and innovative projects. I'm really excited to hear from you, Adam. Over to you.
Thanks so much, Ashley. Good morning, folks. I'd like to thank Taimur and ECDC colleagues for inviting me to speak to you today about good practice examples to reduce HIV-related stigma. As we've heard, stigma, and particularly HIV-related stigma, is a complex phenomenon, but even though it's complex, it has and can be addressed in many ways. Next slide, please. Campaigns have been and kind of continue to be an important tool in motivating the public into action. But over time, the way we approach communication and communication channels has definitely changed, and I would think changed and improved. So I might kick off, we might play that first video so that we can kind of see where we have kind of started from in the 1980s with campaigns.
Enjoy an occasional gamble, the fun, the thrill. Even our relationships owe much to chance. But today, if you play around, the stakes are too high because you're gambling with AIDS. Meet someone who is an AIDS carrier, and although condoms give some protection, just one act of intercourse may give you AIDS and lead to death. Sleeping around is a gamble. Casual sex spreads AIDS.
So this is an example of a TV advert that ran on Irish TV in the 1980s, and I'm sure there are many similar examples of that of the time across Europe. They were no doubt influential in creating awareness. However, they really had a chilling effect on HIV since then. And you know, many to this day recall those kind of TV adverts and the fear they created about HIV, and in turn fear about people living with HIV. In Ireland, you know, there's been no kind of follow-up TV advert, and we haven't updated the public through mass media on what we know about HIV today. However, I see recently the TV campaign created by Terence Higgins Trust in Scotland entitled "Stigma is More Harmful Than HIV" kind of has started that reparation in this regard. And we might skip playing it in the interest of time, but I do encourage you to find it on YouTube. It's a really great example of kind of using mass media to challenge HIV stigma. In Ireland, we've leveraged the U equals U message as a powerful kind of tool in reducing the fear of transmission as a means to kind of stigmatize people living with HIV. The example there on the right was one of the first campaigns led by community activists in Ireland, focusing on the positive impact treatment has on people living with HIV, and how people living with HIV are the solution and not the problem. The example there at the bottom is a campaign ran by the HSE, which is our National Health Service, which ran online and across national public transport networks. And this campaign was really important for many reasons, but most notably, I think, because it was the health service, a wing of the state that was publicly accepting and promoting the science around HIV. And I think that was mentioned previously around that kind of importance of publicly accepting and promoting the science, particularly for our healthcare workers. And communities now working with the HSE, our health service, on a new campaign that has a direct focus on stigma. So we're constantly looking at updating our campaigns around stigma and approaching stigma in different ways. Next slide, please. So media is an important tool in tackling HIV stigma. News media is very important in challenging societal views, and so accurate and trustworthy information about HIV is really key. These two news articles to the left, they're separate issues, but the first relates to a member of the Irish police force, the Garda, being bitten by a person they later learned to be living with HIV. And to the best of my knowledge, there's never been a case of HIV transmission through a bite in Ireland, and a police officer has never acquired HIV during their duties. The risk is extremely low, and even then, you know, transmission would only occur in exceptional circumstances. However, the danger of reportage like this is that it misleads the public and the police about HIV transmission, and it bolsters the idea that people living with HIV are to be feared. So a good example, a good practice, I guess, is to challenge the misleading representations of HIV in the media, with the aim of achieving maybe corrections, and failing that, to bring complaints to the media regulators. The example on the bottom there is of a young man from Dublin who passed away from an AIDS-related illness in 1994. However, an article appeared in the Sunday Times about him in 2022 that made judgmental assumptions and false claims that he was addicted to heroin, and again, kind of perpetuating stigma and shame that had kind of dogged experience of HIV and addiction. The family of the deceased took a challenge, and they very kindly donated the apology compensation from the newspaper to HIV Ireland to kind of further our peer support work. So, you know, there's a kind of a double benefit there in challenging the media, and it leads to correction, and then also supporting the work that we were doing. It's not entirely about challenging media, though. Working with the media to guide appropriate reporting is also important. HIV Ireland, and I know many organisations across Europe and elsewhere, develop media reporting guidelines that advise kind of journalists and editors on accurate reporting. And we've worked with media outlets to proactively profile people living with HIV as well, to share positive representations of their lives, and profiling those in leadership positions, particularly again in the healthcare space, as a vehicle for the message of how HIV has changed. Next slide, please. So continuing on the theme of working collaboratively for change is working with institutions that might be upholding or perpetuating HIV stigma. So we've heard already this morning about HIV-related stigma in healthcare settings, and recently published study by Dr. Elena Vaughan in Ireland found that healthcare workers, they didn't hold negative attitudes towards people living with HIV, but that stigma was largely fueled by fear of HIV acquisition during kind of routine procedures. So at HIV Ireland, our kind of community support team supports people living with HIV to bring discrimination cases, and one of the health professions that is kind of overrepresented in cases that are brought are dentists. You know, offering the last appointment on a day, double gloving when interacting with a person living with HIV. In one case, a person living with HIV attended for an extraction, had a local anaesthetic, was in the chair, had a local anaesthetic applied, and was asked if they were on blood thinning medications. Service user disclosed that she was living with HIV on her admission form, so she mentioned, yeah, just my HIV meds. And the dentist asked her to leave the practice. He claimed he wouldn't be able to offer treatment because he would have to dispose of all of his equipment afterwards. So examples like this kind of lead us to engage with the Irish Dental Association to update their kind of curriculum for new trainees, and to do continuing professional development on HIV for those in practice. And I know another example from the UK is a change to kind of aviation rules that had previously barred people living with HIV from flying, and also kind of, you know, engaging with other settings such as you know, schools around sexual education, and faith centres as well around HIV stigma. Next slide, please. So centering people living with HIV is really crucial and can't be understated. You know, breaking public perceptions that people living with HIV are not their friends, or not their family, or are not their work colleagues is really important. And so is sharing lived experiences. So we saw this work really, really successfully as a tool, actually, in the referenda in Ireland on marriage equality and on abortion as well. People are less likely to hold kind of stigmatizing views when they know of people living with HIV and hear their stories. How to Tell a Secret, a really fantastic documentary style film that was in cinemas across Ireland, and now, as of World AIDS Day, is available internationally on Netflix. It explores the kind of act of disclosing your HIV status and the stigma that drives people not to do so in a contemporary modern Ireland. So most definitely well worth a watch if you've a Netflix subscription. Our most recent World AIDS Day campaign at HIV Ireland focused on women, both cis and trans, and they're often a forgotten and marginalised population in the HIV response in Ireland. So hearing the stories of women and how HIV and HIV-related stigma affects their lives, but it's coming from them, you know, leaders in the community, and that I think is really key. Again, here's another example. Using TV is an important tool for messaging. Here we have Rory O'Neill, who is also known as Panty Bliss, or the Queen of Ireland, a well-known Irish drag queen, and the first same-sex contestants on Dancing with the Stars in Ireland. And Rory performed a dance to the Pet Shop Boys song "It's a Sin." And he dedicated the dance to his HIV consultant, Dr. Fiona Mulcahy, and in doing so was able to kind of use the TV moment to reshape narratives about what it means to be living with HIV today and how much things have changed, but also highlighting the impact of HIV stigma as well. Next slide, please. So tackling self-stigma, I think has been mentioned a few times, and it's a really important aspect of kind of overcoming stigma overall. Supporting people living with HIV is kind of a recognized element of care, but again, you know, centering people living with HIV in that care is really critical. So a national peer support network was developed at HIV Ireland, where kind of newly diagnosed individuals are buddied up with a person living with HIV and trained in HIV peer support. People experiencing kind of rural and urban isolation also kind of engage with the program for support as well. And there's kind of a focus on coping mechanisms and building resilience. Another really fantastic example of tackling self-stigma and using new forms of media is Veda and Robbie's Pause Vibe podcast that platforms people living with HIV to share their stories of coming out of the viral closet and their experiences of stigma, both societal and self-stigma, but most importantly, you know, using the platform to voice their resilience and achievements and strength as well. So the podcast, you know, is not just only a podcast, it's actually built a kind of a movement against HIV-related stigma in Ireland. And so guests on the podcast have actually mobilized together into a Pause Vibe tribe. And here this picture here has them at Pride, kind of challenging stigma on the streets of Dublin. Next slide, please. So very quickly, important that we continue to kind of dismantle regressive laws and policies. Ireland's first case of reckless transmission of HIV was before the courts in 2021, where a man was found guilty and was sentenced to 10 years imprisonment. It was upheld on appeal as well. So we know there is no evidence to show HIV criminalization does anything for preventing HIV transmission overall. And indeed, what it does do is perpetuate stigma, and it kind of may deter people from getting tested and knowing their HIV status. Here on the bottom, the news clipping from 2009 was the first case brought to the Equality Tribunal under the Equality Act for a person living with HIV was refused access to a chiropodist service when he disclosed his HIV status. And the clipping just above from the Free Legal Aid Centre shows the importance of that equality legislation almost 20 years on in combating stigma, as a recent case kind of saw a man living with HIV who had his job revoked from an employer when the employer learned he was living with HIV. The job was on a farm. And the individual was fired straight away and not given access to the internet to organize transport from, it was a rural area, and refused a place to stay or even shower or prepare himself. So, you know, really looking at dismantling dismantling laws and policies, but also using things like equality legislation to press for responses when discrimination is blatantly on show. Next slide, please. So that is me in a nutshell. I want to thank again for your attention, the ECDC for inviting me to speak, and I think we'll move into questions and answers. So thank you.
Great, thank you, Adam. I think that's a fantastic moment to move into a discussion with everyone on the call. So please put your questions to the panelists in the box on the right, and I'm going to kick off. There's actually already a couple, and there's one just about a quite specific one about which countries the survey took place in. Taimur, do you have that data to hand?
Yeah, so around 3,300 responses, and half the responses came from the countries in the west, the green countries I had in the map, a quarter from the center, and a quarter in the eastern parts of the region. So based on that comment, I think it's fair to say that the data I showed you is probably an underrepresentation of the stigma experience, because the further the east you go, usually typically the data we have is that the higher the stigma is. So we had data from 54 of the 55 countries in Europe and Central Asia. Turkmenistan is the only country we had no inroads into. But also just want to point to the fact, to be honest, it's the first time we did the survey. We didn't know what success would mean. I think we're all very pleased with the responses we got, but I think next time we want to repeat this, we want to get a high response rate so we can generalize the analysis and the data in a better way. But yeah, that's the data we have.
Why is it difficult to get this data? What are some of the obstacles that you have to overcome to collect it?
Well, that's a great question. Two-part response here. The first part is it just took some coordination to do it, and just like we're doing, Esteban showed on the healthcare survey now, and with CINI on the community side that we work with the community partners, you just need somebody to coordinate this and drive this. And we didn't have money for the first survey in the community part. It was really driven by community efforts and pro bono work from everybody. And I think the biggest challenge is I think for me the promotional part. So we had the data, we had the survey, we did that relatively quickly, but what was tricky was actually doing the promotion in countries. And to do that, you really need some money to push it out and get, to advertise this. We did advertise it through some of the gay dating apps, and therefore the responses we got were quite a lot from the gay community, but we didn't have other key populations to the same extent. So promotion is going to be really important if we want to reach these other groups that are really hard to reach. And so I think that's the major challenge. Coordination, that we could organize once we made our mind up that this was important. We coordinated, and that was relatively easy. The difficult part was the promotional part, I think, but that's something we've learned a lot about, and we'll do that better next time.
And maybe on that, any of the other panelists about, how you generate, because then you kind of need political will in a sense. You need, you need local governments, you need, you need hospitals, you need communities themselves to actually say, this is important, we're going to put time and money into this. And I'm wondering how you, we've heard how important this is and how there's so much, this is sort of an absence of data. We're getting it now, but there's a big absence of it. How do you communicate that when you're speaking to the people who hold that cash, that, this is actually really critical, and we need to do this? Who would like to go first? I think all of you can contribute to that. Cindy, would you like to?
Yeah, definitely we need the funding part also for the community in the next round. But I think it's also important that now when people actually see that there is an impact, we are talking about the results, we are talking about stigma. So I'm sure that will encourage at least people to participate for the next round. But how to get the funding, I think that's a big issue, but we definitely need more research around stigma and stigma surveys. So I'm already looking forward to have the next round.
Esteban, you've obviously worked also with health ministries, and I'm wondering, when you talk to them about this, is this something that they say, yeah, that's actually something we think is important and we need to get behind?
Yeah, particularly the Spanish government during the presidency of the European Council, which is the last semester of this year, still until the end of December, was particularly interested in promoting a long-lasting effort, initially in Spain, recognizing within policies and laws the access of people with HIV to certain jobs, police pilots, also the access to insurance and recognition not to be expelled from certain jobs because of being HIV positive, etc. So this effort was taken into the European Union, and I think that the European Union should be the echo machine, giving it further into those areas, particularly Eastern Europe, Central Asia, where the needs are bigger. So that's something. It's a part of the chain. Another step, I think.
Thank you. Adam, you've been involved in a lot of really interesting, innovative sort of like modern interventions, interventions that actually, are, reaching people where they, watching their TV shows and where they're, with the clubs that they're going to and the festivals that they're going to and that sort of thing. Do you have advice for people on the call who are thinking, how do you come up with these, things that are quite like cool and quite, actually that work really well? But is there like a model when you're coming, are you having focus groups? Are you talking to, experts? Are you talking to communities themselves? Your few minutes advice to people wondering how to do what you guys are doing.
Yeah, I think collaboration is really, really key. I think to really achieve what we and others kind of in the sector have achieved in kind of challenging stigma is really, really focused on collaboration and making sure that community is at the very center of that. People living with HIV or people affected by HIV. And learning how, maybe through focus groups and having meaningful engagement around the table, to kind of thrash out what the issue is, what it is, where it could be challenged, and how it could be challenged, and working in that kind of collaborative way allows the issue to be presented. Perhaps it's from a healthcare perspective, or it's from a law perspective, an education perspective, etc. And then that being kind of molded through the lived experience, and then people with the skills around the table to make it cool, make it attractive. So that kind of collaborative piece, I think, if you're looking to either replicate anything that's worked, or to look at something new and fresh, I think to try and get as many people around the table as possible, and to have some fun with it, because I think meeting people where they're at is really important. Speaking the language in which the target audience speaks is really important for it to be effective and for it to land properly. And I'm also always available to have a chat if that's helpful. I'll definitely put cool interventions on my CV.
We have another question about whether there needs to be knowledge development around intersectional stigma in Europe, and I'm sure that everyone would say yes, there needs to. We need to do more work on this. But I'm interested to hear, maybe Taimur, you can go first, and the other panelists as well. But how we, we're talking about collecting this data, we're talking about how to eliminate it, but then we're not maybe we even go back before that, like what this means, and which is some of what we heard today. But maybe Taimur, would you like to go first on that question?
Yeah, I think I'll start. I think what I said towards the end there on, the slide that I showed on the key population's experience of stigma, that wasn't really included in the report because we didn't have enough sample size in these other populations. And I think that's going to be a great challenge going forward. We had challenge overall getting responses to this survey, and thanks to our connection with the gay dating apps, they do one free pop-up message and boom, we got lots of responses from the gay community. But we need to look at transgender people, we need to look at migrants, sex workers, prisoners. Those were the groups that we didn't have so much data on, and that is where the intersection comes in, right? And they are probably, without having data from our survey, experience higher stigma. And so the question was, how do we do this knowledge development? Well, I think again, there needs to be investment, right? We need methods to work with the community organizations to reach out to those groups for the survey. And I think that's something we've learned a lot. So Sini will laugh, but I always say the first time we did the survey was, let's not perfect be the enemy of the good. It wasn't perfect. We learned a lot now. And now we need to take those learnings and see how can we then reach out to those other groups and try and get to capture their experiences. That's going to be a great not challenge, but a great opportunity for the next survey that we do. But I'd like to hear the others respond as well.
Yeah, I'm interested in Sini, in the experience in Finland, how you reach out to groups and not necessarily as easy to access, and how you go about that, and if you've had some success stories, perhaps.
Not sure if I have success stories, but we do close collaboration with the other groups. We have a really good cooperation with the sex workers organization. We do meet trans people for the transgender organization. We are sharing same premises. They are using our meeting place, and we are using theirs at other cities in Finland. So we kind of try to keep the really close contacts. We also, I'm chairing a Finnish HIV network that we have different organizations participating, and also the communities, people representing the certain communities participating in those meetings and sharing really the views, what we are actually talking about and what are their experiences. So that's a good forum for that.
I'm wondering how you bring healthcare workers into this, as we heard that that's like a really critical area, and that's a really, it's affecting people's access to care, not for HIV only, just for, for everything. And we heard, pregnant mothers experiencing this. And, how do they're not necessarily, the nurses and the doctors and the pharmacists are not necessarily involved in these discussions. This is something sort of outside what they consider their job. So how do we bring them in?
Well, I think that having launched a survey that addresses these questions and this issue to any healthcare worker is the first step. So I can imagine that, for instance, many specialists that are not readily caring for people with HIV, let's imagine, for instance, traumatologists, for instance, or any other which specifically do not address HIV, may not be so aware about all of this, and they may keep the reminders during the school years or the initial of their careers what HIV was, and at that time, in the decades ago, it was quite different, and the perception that they may have similar to that in the general population is not the real one. So certainly bringing their attention to this, and also bringing some kind of updated education are key points to consider when addressing to all these healthcare professionals.
Great. Adam, I'm interested in also hearing a bit more about some of the work that you've done with media. I think that's also a really critical area, and we've seen quite a lot of negative press articles. But how do you engage with the media and bring them into this conversation? I know I'm a journalist, and it's not always, we're like, oh, we don't have time to talk about that. Like, we just have to write our story. So how do you engage with them, and how do you also call them out when you need to?
Yeah, I think it can be a fine line. I think again, collaboration is key, and I suppose trying to make, because of the kind of fast-paced nature of journalism, trying to make the job easier for the journalist, I think is a nice kind of a gateway to that. So like that, the media reporting guidelines kind of supports people. It supports kind of journalists and editors in having the language to use. We also have made sure that we kind of constantly invite journalists and some of the kind of key, particularly health journalists, to many of our events, so that they're kind of constantly being exposed to the kind of education and training elements of the work. So yeah, it's kind of exploiting other opportunities in the media, as you saw, kind of, with TV programs, and, it was a dancing competition. How do you make dancing about HIV? But again, kind of trying to hit as many opportunities in the media, and to bring the media along with us. There are occasions where, of course, you have to call out the media, and that must be done, but thankfully that's becoming less and less, and more, because we've kind of, I guess, brought journalists and media outlets along with us. and kind of invited them to be collaborators with us, it kind of reduces the possibility of those negative aspects. Although in saying that, of course, in the world of kind of social media, misinformation and disinformation, that anybody can, with a laptop can throw up a blog post and get quite a lot of traction. And we are seeing that more and more. And particularly one example would have been the recent HIV statistics that were released by our health service here in Ireland. And the way in which those numbers are kind of presented is overall notifications as opposed to divided into newly diagnosed and transferring care from abroad. The journalist, maybe the less careful journalist, might look at a top level figure and very quickly start to point fingers towards migrants, because of the large influx of people that are transferring their care, without digging a little bit deeper to know that the vast majority of them are on treatment and undetectable and not part of the transmission cycle. So, information being weaponized like that is really important for us to stand up against. But generally speaking, the mainstream media in Ireland has been very supportive of our a rise of the far right that needs to be challenged.
I think one of the solutions to that is also when you get those press releases that they explain, the data really accurately and in a really easy to, understand way for journalists. And I suppose that's also a call to the ECDC, who does a really good job of that, I think. But just also a reminder to other organizations about explaining, putting those caveats in. I'm also interested in, Teimo, if you could just explain a little bit about what the ECDC plans to do, in the coming years and in the, as we get up closer to 2030, where we have these big targets and there's lots of concern about not meeting them, and how HIV stigma and the work that you're doing on that might help us, get a bit closer to reaching those targets.
Yeah, as I said before, we have really great data when it comes to prevention, testing, and treatment. This is the area where we've had the biggest gap on, and I'm super excited about the data we have from the community, and the data that we're going to get from the healthcare survey that we're doing now. It's just going to be amazing, I think, and it's been really I wouldn't say driving the agenda this year, because I think the Spanish presidency has been driving the agenda, but we've contributed with this data and really been able to show something that we all think is important. We've always said this is important, but we've never really had good enough data. We've had some country examples that are doing great work, but from a European scale, we haven't. So the aim when we start with this for both these surveys is to repeat them over time. It is so the community one was collected in 2021 and 2022 and was published this year. So I don't want to rush into the new data collection, because I think we're still influencing meetings like this and policies and programs with the data we have. But I think by next year, we should start planning for the next survey, which should be in 2025, because 2025 is going to be a key year, a milestone year towards 2030, right? So it would be good to have one benchmark in 21, 22, another one 25, 26, and then a final survey around 2030 to see progress over time. So 3 data points I think would be fantastic for both these surveys. So that's the aim. We'll see if we're able to pull it off.
Great, thank you. I don't think we have time for anything else. I want to say a massive thank you to our panelists for really fantastic presentations and really great insights. And to any people online who had more questions, I think most of the panelists had their emails, at the end of their presentations. So this is going to be on YouTube. You can check back and get in touch with them if you do. I think we've seen that, obviously a lot of gains have been made in the towards tackling HIV in Europe, but this fight is really far from over, and this is a key area that needs to be tackled. And one of the messages that the ECDC wants you to take away is to inform yourselves, learn about HIV stigma, how to address it, and that everyone can make a difference in this. And as an example, just a reminder to check out the social media platforms on Instagram, YouTube, TikTok, and Twitch on the hashtag zero-stigma. You'll see quite a lot of interesting social media posts, and there's influencers sort of doing the work that Adam's been describing. So I think that's a good example of this. And please continue that discussion on social media. And thank you everyone for joining, and thank you for listening. Have a lovely day.
Thanks.
Bye.
Bye.
Bye. Thanks.